Well, thank you very much. It's great to be here with you today, and I hope you aren't fully through with your biotech attention span and be willing to consider one more. Stingray is a cancer company that is involved with immune therapies. So we actually use the immune system to attack the cancer. And the benefit of doing that is that we can do it with far fewer side effects and somewhat different side effects than chemotherapy. The big challenge in this field has been that your immune system has two arms: adaptive immunity, the T cells and antibodies that you make, and innate immunity, which is essentially the production of interferon. And we don't have any therapeutics in innate immunity. And Stingray hopes to be the first successful innate immune therapeutic. Next slide. In our space, we're really looking at four key areas that we're trying to advance the standard of care in a very significant way. The first is metastatic microsatellite stable colorectal cancer. Now that sounds like a mouthful, but the reason we all get colonoscopies is because 85% of colorectal cancer, if it shows up, is this kind of cancer. And this kind of cancer is very resistant to our current therapeutics. And your chance of being alive in 5 years after diagnosis is only about 13%. That means 87% of people diagnosed will die of their disease. We think we can make a real difference in that disease. And then behind that, we're very interested in prostate cancer and breast cancer. And then really more from awards and grants perspective, we're trying to move forward in making a dent in tuberculosis. And we would love to do that. Next slide. Now, this is the team. I'm a CEO and co-founder, and my partner and co-founder is Dr. Sunil Sharma, who's an incredibly talented clinical translational oncologist in Phoenix, Arizona. He's Deputy Director of Translational Genomics Research Institute. And then behind that, we also have a very skilled team, people deep in immune oncology like Monil Shah, who heads our development, great cancer biologists, and other people that have really been around. And I have worked with most of these people across 3 cancer companies, really developing our model and making it go forward. Next slide. We are currently in phase 1 studies in Australia. We have an accepted IND in the US, and we plan to start next quarter our colorectal cancer study here in the US. Now, our drug is called SR-8541A, and what it does is it stimulates innate immunity. Cancer is able to turn off both arms of the immune system, and if it turns off innate immunity, then adaptive immunity cannot see the cancer, and the cancer is able to grow unchallenged by the immune system in stealth mode. And this actually happens in about half of all cancers. So this is a really broad therapeutic that has major potential in oncology therapy. Also in tuberculosis, tuberculosis is one of the few bacteria that actually lives within our cells. And the way it's able to do that is it secretes a bacterial protein that turns off innate immunity. And we have a scaffold that works both against tuberculosis's protein and ENPP1, the mammalian natural turnoff of the pathway. Next slide. Now, I'd like to just talk a little bit about validation of the program rather than forcing you to go through a deep dive on the science. If you do get interested, I'd love to take you through the science. We have absolutely fantastic science. But I want to point out the validation and award support that we have. We've raised not 9 million to date in equity, and we have 16 million in grants and awards, of which the majority of that 14 million is going to be dispersed over the next 3 years to support 2/3 of our colorectal cancer study and 2/3 of the company from the state of Texas. So we're very excited about having received that. We also have received from NCI a $2 million award in breast cancer, which is the second trial that we plan to do. And so this is really very pleased that the company has been recognized in this difficult time for the work that we're doing. Next slide, please. I'm also pleased to say that we have validation from 3 impact investors who are in the company. The GKCC family office out of Chicago that has invested in the company twice. Spring Hood Ventures out of Boston that has invested in the company. It's part of the Charles Hood Foundation. And Catalyst Impact Foundation, which is invested in the company. So we're very pleased to have these kind of investors in the program as well. Next slide. So this is my one science slide, and then I'll leave it alone. But this is the innate immune pathway. And innate immunity is called innate because it's in every cell in your body, and it essentially is looking, surveilling in the microenvironment of the cell for foreign DNA, which means infection or cancer. And when it sees it, it keys the pathway. The pathway then produces interferon. Interferon can be produced very quickly, and it's a very broad fighter, and it immediately comes and starts to fight. It also inflames the area. That inflammation is what white blood cells see, and then they come to the area and join the fight, bringing T cells and antibodies. Now, what cancer does is it upregulates a molecule called ENPP1 that sits on the cell surface, and it can solubilize off the cell surface and get into the cytosol and all kinds of places. It dramatically upregulates ENP1 1 million to 1 billion times. ENPP1 then grabs the second messenger in the pathway and degrades it, hands it off to CD73, and CD73 makes adenosine. So what happens is the pathway is firing, it's seeing cancer, it's trying to make interferon, but the cancer is perverting the pathway to make adenosine, adenosine being very pro-metastatic and broadly immunosuppressive across both innate and adaptive immunity. What we do is we have a simple oral tablet that you just take orally, and what it does is it sits in the important pocket of ENPP1 that's doing all the damage and blocks it from being able to do anything. So we neuter ENPP1 so it can't do anything at all, and that then restores the flow of interferon and allows the pathway to work. Next slide, please. Now, we're here talking to you because we've been well vetted, as I showed you. You probably know someone impacted by these diseases. These are some of the biggest cancers in the cancer community. And, you know, cancer just doesn't care about your FICO score or how wealthy you are. It just attacks. And what we want to do is make sure that our solution gets to market and make sure that people are treated well. And so this family office group represents some of the smartest and most capable people in the country. And we'd really like to ask you if you might be part of the solution. And that's why we're here. Next slide, please. Now, I've got some slides on the various cancers, and I'll try to go through them quickly, just trying to give you some basis here. So again, colorectal cancer, a very deadly cancer. You don't want to get this one. Your chances of surviving are poor. Currently, there are 2 second-generation checkpoint inhibitors in clinical development that have shown the best response. But that response is only good if you don't have liver metastases. And liver metastases are very common in this disease. So we think adding our agent to that doublet will work if you have liver metastases, and it'll also juice the response if you don't. So that's where we're trying to go in colorectal cancer. And obviously the state of Texas thought we had a good chance of changing the standard of care because they're backing that program too. Now, let's go on to the next one. Next slide, please. Now, in prostate and breast cancers, these are cancers that we do have a lot of therapies for, and you can live a fairly long life. But if you get into metastatic disease, these cancers will often kill you, particularly in some of the pieces of them that are very hard to treat. And we can work there. So these are the 2 areas we want to go into next. We feel very good that if we have 3 shots on goal, we will be able to be acquired by a pharmaceutical company in and around 2026, because certainly one of these will work and maybe all of them will work. Next slide. Finally, just to talk a little bit about what we're looking for grants and awards, because you really can't pursue tuberculosis with the idea that you're going to make people a lot of money. It's just a disease of the very poorest people of the world, but it's a contagious disease that we can catch from them. And it's a very difficult disease to cure. Host immunity is very important. We can make it much easier to cure this disease. So we're looking for grant, non-commercial funding for this effort. Next slide. I just want to say that we have very strong patent protection. We have 4 patents already achieved, 3 in process. We own these patents entirely. We don't have any obligations to any university. We did all our own work, and therefore there are no economic obligations if you're in this company with me, except we do have some obligations to the state of Texas, which are very reasonable for the $14 million award. Next slide. So this is the plan. Stingray was the first company to start a program in ENPP1 inhibitors in 2016. So I've been 8 years pushing the program forward with my companions, and we feel we're 3 years away from being acquired by a major pharmaceutical company. We would be acquired both for the potential of our compound, which could be a blockbuster drug, but also because we dramatically enhance anybody that has a checkpoint inhibitor in their stable of drugs and the ability of that to go in many more cancers than it currently goes in. So it's a twofold benefit to the pharma company. Next slide. So this is the competitive landscape. There are 2 other companies that are in the clinic with us, but we have a far better program. And I'd be happy to talk about that if we have time, why our program is better. But it is very interesting. And so we feel like we're the leading program and the most attractive program for a pharma company to buy. Then we have 4 companies trying to get into the clinic, probably a year away, that are behind the curve. Next slide. So I just want to spend a minute. I can't, of course, promise anything in the future. My favorite philosopher, Yoda, the future, very difficult to see. But I do want to say that if we look at just the kind of money pharma has spent for programs in innate immunity, which is exactly our wheelhouse in this space, it's been phenomenal. Typically, the upfront that they've paid has been $250 million, and the milestone package they've given has been over $1 billion. So this is really big money. Next slide. And this is just the straight arithmetic average of every deal that's known and published. So If I just do back of the envelope calculation and try and say, well, what could that mean? Well, we're trying to raise our current Series A at $5 a share. And if we got that average package, and I do the math, and we have a successful product equal to, say, a checkpoint inhibitor, then we should be able to generate for investors from that $5 a share about $100 a share in the milestone package and $750 a share. In the $100 a share in the upfront package and $750 a share in the milestone plus royalty package. So you can see this is the thing about biotech. Biotech tends to be riskier than other investments, but when biotech comes in, it can come in with a real bang and juice the whole portfolio. Last slide, please. So just to sort of recap, I'd like to say we're very close to exit. We've been extremely capital efficient, very high award levels. We are running right now 173% award to capitalization to equity, that these are big potential diseases that pharma should pay very dearly for. And we have notable investors in the program, both regional venture, impact investors, and many angels. We have a major drug. We are repeating our model for the third time. And I hope you will join me in this program. We'd really look forward to having you as a partner in Stingray Therapeutics. Thank you.
How big is the round?
So we're looking for 10 to 15 million in the Series A.
And the pre-money is
29.3 million.
So it's not much more than the amount of grants and equity that's already been invested.
Right. And it's juiced by that $14 million award, which pays out over the next 3 years.
Other questions from the audience? Well, fantastic. Well, listen, thanks so much, John. Excellent.